Good afternoon. This is a case of a 53 years old female. She has a past medical history of dyslipidemia, type 2 diabetes, not on medication. She presented to our hospital with acute onset of cardiac chest pain and shortness of breath since a couple of hours. She was vitally stable, and ECG shows ST elevation in anterior wall. So initially, we activate the pathway, STEMI pathway, as a standard acute coronary protocol. Initial work lab shows little increase in troponin. NT pre-MP is high. Lactate is a little bit elevated as well, and creatinine was within normal. So the procedure was started, and as expected, there is an proximal ostial LAD occlusion. There is a diffuse disease on the LAD, on the circ as well. So the operator just opened the LAD with a long stent, and this is the final result. So there is some heaviness on the ostial part of the stent. He actually find that the patient is stable. TIMI flow is maintained, and he just start to treat the other thing, and he said for this lesion is for relock. So the ejection fraction is reduced 40 to 45%. Her creatinine was good, hemoglobin is okay. She's improved after a couple of days. She was treated as with heart failure medications, and she was started as well on glycoprotein 2B3A inhibitors for 2 days, and she came for the relock after a couple of days. So this is what we find again. Same heaviness on the ostial part of the LAD, and there is some heaviness as well on the circ. So we did an OCT this time to see what is exactly happening with this ostial lesion. And if you come to see from the left main going to the proximal part of the LAD, there is actually a thrombus, and there is some part of the strat is actually protruding to the left main. So we did as well an OCT toward the circ as well. And if you come to see the OCT is showing the same thing. There is some strat is protruding into the left main with the thrombus, and there is also a thrombus on the ostial part of the circ as well. So these are the still image of the OCT. So after that, we actually decided to do PCI to the left main LAD. It's a provisional stenting, and we sized the stent based on the OCT. I put a stent on the left main LAD as a provisional stenting, and then I did the pot for the proximal part of the left main. I did side pot for the circ, and I did final kissing. So this is the result after the procedure, and we did actually a final run of OCT to make sure that the stent is well apposed, there is no dissections, and the sizing of the left main is good. So this is the final result by angiography. Still, there is some thrombus maybe on the ostial circ. And we decided to continue with the tyrofepam for a couple of days. So in summary, I just want to emphasize the importance of OCT, intravascular imaging, to understand the mechanism of problem you had, and to guide you through the management of this problem as well. And the other thing is, kneeling the ostial LAD is always challenging, and it's difficult to do. Some people now just abandon doing ostial LAD, and they do left main LAD directly. So